They told you, with your personality, with your hair, with your hijab, with your skin color, with your preferences, with your gender. They told you, with their silence, with their words, with their resentment, with their absence. They told you, you don't belong. Yet, here you are.
So hi, I'm Helen. I'm one of the ASSET exec members. I'm currently the webmaster and bursary liaison officer, and I'm also general surgery registrar working in Yorkshire.
Good morning, I'm Srin Chiruvu. I'm the current ASSET president. I'm based here in the West Midlands, and my specialty is trauma and orthopedics.
Hi, I'm Michael. I'm the Equality and Diversity Officer for the Association of Surgeons in Training, and I'm a general surgery registrar based in London.
Yet, here you are.
Mr. Christian Macutkiewicz is a consultant general and HPB surgeon at Manchester University Hospital, and he is the clinical lead for general surgery. He is the president-elect of the Association of Surgeons of Great Britain and Ireland and the events lead for the Pride in Surgery Forum.
So, Mr. Macutkiewicz, thank you so much for joining us today. We wanted to find out a little bit about you, if that's okay. So, first of all, we'd like to know, what is it that you usually do in your spare time, and what are your hobbies outside of work?
So this person takes up quite a bit of my spare time. Rupert is famous in ASGBI because he was the Congress mascot when we had our virtual one during COVID. So he got most of the limelight then, didn't you, mate? So walking the dog is probably my one time I get to spend time on my own. At 6 o'clock in the morning, I often see the sunrise, and in the winter, it's nice to see the sort of mist and everything coming off the grass. It's a nice time to sort of clear your head and get some exercise. So that's probably one of my most enjoyable things. But then the thing I do the most is cooking. So I will happily spend hours in the kitchen experimenting with ingredients and doing different cuisines. I've got about 150 cookbooks, and sometimes I do drive the household mad with the number of pans and pots that are all over the place because I'm trying to make some delicious thing, which usually is delicious, but sometimes you can have mishaps. But that's probably my number one passion, is cooking. And to go along with that is travel. So I love exploring. We've just come back from Bali, where we spent a week on the beachside resort. But then we sort of explored the inner lands and went into some the rainforest, the jungle. We went to a yoga retreat and did meditation. So I like exploring different parts of the world and picking up sort of recipe tips. And I went to a cookery school. I've got a Balinese cookbook to try out when eventually I get my kitchen back, because we're currently doing an extension. So that's what I like to do in my spare time, and that pretty much fills my spare time.
Christian, when and why did you decide to become a surgeon?
So this was an event that happened on a single day that made me think, wow, yeah, medicine is what I should be doing. So I've always wanted to be a chef. All my family are in the restaurant or cooking or food preparation or farming. So everybody has something to do with food. And so I always thought I would go into cookery. I wanted to go to the Cordon Bleu cookery school and everything like that. And it was my dad that wouldn't allow me. Dad, bless his soul, not with us anymore. But Dad said, absolutely not. It's an awful lifestyle. There's poor pay, really long hours, really antisocial working practices. It's really hard for your family life. Do you get a pattern here? And you're too brainy, so you're going to have to stay at school. And that really upset me, actually, because I really wanted to take over my grand's business. She had a little hotel and restaurant business in Nottinghamshire, and I always thought I would take over that and run it and expand and have my own little empire like Gordon Ramsay. But that was never to be. So I stayed on at school, and I was always good at maths and sciences and biology and things like that. So I thought I'd do sciences. And then I really enjoyed, from the exploring side of things, I really enjoyed the Duke of Edinburgh Award Scheme. So it was on my silver award expedition, and we were going through the Derbyshire Dales, and I was the first aid officer of our group, and we were walking through sort of a little country housing estate, and we heard a bang, and it sounded like a skull hitting the floor. And we turned round and looked into somebody's garden, and there was an old man that had obviously been on a ladder washing his car, and he'd fallen and cracked his head on the floor, and he was fitting, and blood was pouring out of his head. And without even thinking, I went straight up to him, realized he was choking on his tongue. I got his tongue out. I did a head tilt, chin lift, opened his airways up. And then I told all the rest of the gang to go in the house, call an ambulance, get a pillow, get me something to stop the bleeding. And he got into the ambulance and we saved his life. I'm getting goosebumps telling you this story because 6 months later, he came to our school and he came to thank us. And it was an amazing feeling. And when that happened, I thought, wow, yeah, this is what I've got to do. And then I applied to do medicine, and I got in at Birmingham. And then it's the days before the UCAS exams and things like that. So I'm old, so it was A levels. And I got a BC in my A levels, and I was quoted 3 Bs. So I thought, oh, okay, it's the same points. But for some reason on my year, we were oversubscribed. And so when I went to Birmingham, they said, sorry, you can't get into medicine. You'll have to do something else. And obviously, 18-year-old, slight hothead. I drove down. I thought, I can't have this. So I drove down to Birmingham and I went to the admissions people, and they said, sorry, we've oversubscribed and you're just going to have to do something else. And I said, well, what do you suggest? And they said, well, if you really want to do medicine, then why don't you do biochemistry or human sciences? And then after a year, get a 2-1 and then transfer over, because the medics do the same thing. You'll do physiology, you'll do anatomy, and you'll do biochemistry. And so it's a straight swap. So I thought that's a brilliant compromise. So off I went to do biochemistry, loved biochemistry, got a 2-1. And lo and behold, they were oversubscribed again. And they said, sorry, we've got too many people. Why don't you do the second year, get a 2-1, and then transfer over after the second year, because they're still doing basic sciences. I said, okay, not what I wanted to hear, but I'll go for it. And then you know where this is going. On the third, so I got a 2-1. They said they're oversubscribed. Finish your degree, get a 2-1, and then you'll just come into medicine. So I finished my degree. I got a first, and then I told them to stuff off. And I went to Manchester instead. Manchester were very, very good. I loved it in Manchester. And that's my medicine journey. That's how I got in. So moral of the story, work hard for your A-levels and get the actual grades. I think I enjoyed going out and exploring alcohol. I think that's probably my downfall in my A-levels. But adversity gives you a little kick up the arse. So if you really want something badly, you carry on pursuing it, and you'll get there.
My next question is, what challenges did you encounter during your surgical training, and how did you overcome them?
So I think there's challenges in different forms. I'll go for my training first. So the two main challenges in training were geography. So I was in the Northwest Deanery, and they could send you all the way up to Barrow-in-Furness in Cumbria, and if you're based in Manchester, that's getting up at 5 to drive up, or living up there. So I lived up there for a year, and although it sounds hideous, it was one of the best years I had. I lived in the Lake District. I used to go to Windermere, Coniston. I used to go up all the hills. I used to go to all the farm shops and get nice food. And it was a wonderful year, and I would do it again. But it does have an effect on relationships. And I think the geography and relationships was really difficult. The other things that affected me in my training was being gay and not wanting people to label me as, oh, that's the gay trainee. So I think for me, I think it'll be different for everybody now. And I think now that I'm even having this conversation with you, it will be different for everybody. But for me, I wanted all my bosses to know me as Christian, the really fantastic registrar who's always in. He knows everything. He's on the top of his game, and we can trust him to do everything. So that was the number one overriding thing. And I think because of that, I did work harder than everybody else. I thought I had to be in before everyone. I thought I had to leave at the end. And so I was usually in at 7, and I wouldn't leave till 7. And I did enjoy my job. So for me, it's not a hardship. If you go in at 7, because you can get a car parking space and you can prep all the patients and you can make sure that everything's right. For me, it wasn't a hardship. I wanted to be the best surgeon I could possibly be. But there was a pressure there that I didn't want people to judge me. And that's how I felt personally. I know that there was a previous gay registrar higher up than me that did take his own life because of the difficulties he had. And so I was very anxious not to be out and discuss anything. So the inevitable discussions in the coffee room about gay people and things like that, I just shut up and I just blanked them and ignored them. So that was one of the challenges. I don't think that happens anymore, or not as much. It certainly did happen in a few of the hospitals. There were hospitals that were worse than others. I'm not going to name any of them because I'm sure they've changed, because I'm sure a lot of the old people have retired and it's not worth sort of dredging that sort of stuff up. I came out in the last year of my higher surgical training, and the reason I did that was I had the reputation now that I ran the show. I was on the HPB unit at North Manchester General. I'd already had a chat with the old boss where he said, this chair is eventually going to be yours. You're going to have this desk. This is going to be your office. And I thought, do you know what? I've been accepted. I've made it. This is they're telling me that they want me as a consultant. And that's when I told them it. And they were all amazing, as you think people would be. They were all amazing. And very, very supportive and embracing. And I think that's where things have changed for gay trainees now. We've had quite a few gay trainees come to our unit, and I don't know whether it's because they know I'm gay or because we're very inclusive. We have the most diverse team. We've got a gay, Chinese, Jewish, Syrian, and a amazing lady who literally whips us all into shape. So we have the most diverse team I think you could possibly ask for, and I think that is what makes us work together, and we're all friends and we all go out and it's ace. So that's the trainees bit. And then it doesn't stop at consultants. So there's bullying and undermining when you're a consultant. It's much more subtle because it's often by well-respected senior people who don't like young upstarts or feel threatened that that you are treading on their toes, or you're doing stuff that they can't do and they're a bit jealous that you can't do it. So there's been a bit of that as well. And I'm a big boy now, so I just call it out, and it makes them feel really uncomfortable. And then I just move on, because life's too short and you just got to enjoy what you have. So those are the challenges I've had.
So I guess we'll kind of continue on talking about your current work, if that's okay. So what do you enjoy most about your work at the moment, and what do you think is the most rewarding aspect of your current job?
So there are two main things, that actually probably three main things that are really rewarding that I can think of. The number one rewarding thing, and it's the same for every single specialty, is seeing a sick patient get better on what you've done. As we're surgeons, it's wonderful to see somebody come in as an emergency with something horrendous. You take it out, you fix them, and they go home. You see them in the clinic and they're so thankful. And that always just gives you a little lift. In elective practice, certainly at the moment, with hernias being so poorly managed during COVID and sort of subsequently, patients are just so grateful that you've fixed their hernia. They can go back to work, they can get on with their lives, and it's really, really rewarding. From a cancer perspective, so I was a pancreatic cancer surgeon in Leeds for 5 years. Absolutely loved Leeds, loved all my colleagues, loved that. But pancreatic cancer, really difficult, and really rewarding when you can tell them that you've taken it out and that you've given them their best shot. And that's always very emotionally draining, but rewarding. The opposite side of that is when you tell them that it couldn't come out or that you can't operate. And that's a very challenging, emotionally draining aspect of the job, which, you've got to have your colleagues to be able to support you, because sometimes it's really difficult. The other really rewarding aspect of my job, and any job, I guess, is training the next generation. And there's nothing more rewarding than watching Registrar X come to the unit, not being able to do an operation, and 6 months later leaving the unit, doing the operation in front of you while you're there watching or holding his or her hand or their hand. And that's a really rewarding part of the job, because you literally are training the next generation. And getting the feedback from GMC surveys and training surveys that you're doing a good job is really important. And otherwise we wouldn't be doing it. I wouldn't be in a teaching hospital. I'd just be in a DGH, just knocking out gallbladders, hernias and whatever, and not bothering about training. So I really value the time I get with trainees to be able to do that. The final rewarding thing is more on my leadership journey, and it's being able to build a team of 5 completely different people, where we work very different to most teams. So all 5 of us are different specialties. There's 2 HPB, 2 upper GI, 1 colorectal, major trauma, and we all look at each other's patients. We all look after each other's patients. We do a ward round a day each, so that each day a consultant delivered ward round for every single patient, even though they're not yours. We cross cover, and if any of us are in trouble, one of the others will come in and help. And I've been very fortunate to have fantastic role models during my training on what the best forms of leadership are, and certainly getting a flat hierarchy where there is no boss. All 5 of us work together, and that the trainees who come through our unit think that, wow, this is a really nice way to work. So we're all on hand if ever there's a problem. There's no, oh, this is Mr. Chan's patient, I'm not looking after this. It's all very much, they're all our patients. And I think being able to shape a unit and a leadership style in that way, I think has been very rewarding for me on a higher level.
So Christian, what are the most rewarding aspects of your non-clinical work, such as being the president of ASGBI or president-elect, and the events lead for PRiSM?
So the most rewarding aspects of being involved with the ASGBI were when I was director of the scientific program, was being able to shape the Congress for 4 years. So being able to identify speakers that I wanted to see speak at congresses, getting involved in the scientific program. And although it's probably one of the most demanding parts of the ASGBI, it's 9 months of solid work leading up to the Congress. I mean, you guys in ASIT will know what it's like to organize congresses. And then it's 3 months of nothing, and you get euphoria that you've got rid of it, and then it all starts again in September. So Demetrius Damascus is now the scientific program director, so he's got all of this to come, but he's got lots of help. From a president-elect side of things, I'm getting involved in a lot of the Royal College work in terms of getting involved with guidelines, getting involved with training opportunities, and for me, it's a role I never thought would ever happen. It's not something I ever thought I would rise to this sort of level, and so I feel very privileged to be able to do this, and it's really important work. It's all behind the scenes. It's thoroughly enjoyable when you see something come to fruition, and I look forward to progressing into the president role, because Jill Tierney, who's the current president now, we share some of the roles because it's quite onerous when you've got a busy practice and you're trying to keep some clinical work and do the pres work. It's quite a lot of commitments all over. You have to go to all 4 colleges regularly, so we sort of split that. But I think it's a really important role nationally, because we're the only real surgical organization, general surgical organization, that has direct access to government Royal Colleges, and so it's quite a big voice that I think is really important to represent the generality of surgery rather than any subspecialty. So I think it's really important work. It's only just starting for me, so I guess I'll figure out how busy it is. I'll end up having to cut back on some of my work. I've got amazing colleagues who have already said, CMAC will cover you whenever you need to go away. Don't worry about it. So I think that I'm blessed with having amazing colleagues that allow me to do this. From a PRiSM perspective, it's been a bit up and down, to be honest. We had an amazing first out at the college last year, and this year's out at the college was going to be at the Royal College of England outpost in Manchester, but that sort of fell through. And so we're all a bit disappointed by that. But putting my ASGBI hat on again, I thought, wouldn't it be nice to have out at the Congress? And so we had the first PRiSM out at the Congress on the last day of the ASGBI Congress in Harrogate. And it was a brilliant opportunity to get all of us together in one room. We've never all met, ever. It's always been virtual. So I think all the London ones meet every once in a while, but all of us up in the north generally don't get down to London that often. So it was lovely to see everybody. There was a small but engaged audience who did ask questions. And I think I said to Ginny and Karen and everybody that it's the first one. It's always going to be a small thing at the first one. And we're going to have it again in Belfast. We're going to keep having it until it becomes a really celebrated part of the Congress. And for me, that was a really big deal. And as the events lead, I think that's the thing that I contributed the most. Where we're going to go, we're just going to go stronger and stronger. I've been invited to the widening professional medics network Congress at the end of this month to talk about PRiSM and being an out gay surgeon and the challenges that we've had. So for me, although I never thought I would be like a poster boy or anything for human rights, it's not something I ever thought I would be. It's kind of cool to be able to inspire people to join the profession, because it's awesome.
Thank you so much. My last question, what advice would you give to medical students and junior trainees in general and those from underrepresented groups?
This is where I think things have changed a lot since I was a trainee. I think my experience shows if something happens that your life doesn't go the way you want it, if you really want something and you persevere, you will make it. So life's got amazing twists and turns to it. I would never thought I would be back in Manchester. I always thought I'd stay in Leeds. My other half got a fantastic job in Manchester, and I decided family comes first, and so we made the move back to Manchester. It's been great for us, but your career takes left and right turns, and I think you just need to go with it. And accept it and embrace it and go with the opportunities that come. I never thought in a month of Sundays that one of the presidents of the ASGBI would be an out gay person. Never, ever, ever. And I certainly never thought it would be me. So you just go with it. And I think that's one of the great things about medicine. The other great thing about medicine is, as a career, is you can reinvent yourself. You don't just have to do one thing. You can change directions. In surgery, I've gone from doing HPB, liver and pancreas, to HPB, pure advanced pancreas. And now over here, I'm doing HPB, general surgery, emergencies, trauma, and everything. And you just have to go with it. So that's probably the number one broad thing. Underrepresented groups, I think nowadays are so much more embraced. I think we as a profession embrace diversity a lot better than we used to. And I think that's an amazing thing to see. I've seen it in my training. I started as a higher surgical trainee in 2006, and even now it just gets better. There's so many EDI committees in every surgical society now. 5 years ago that didn't exist. So it's amazing to see how better we are. We can do so much better, but the seeds are there for things to be a lot better. I think and it's one of the talks that I'm doing at the weekend, is I think medicine still has a stigma that it's just for posh people or rich people. My dad was a mechanic. My mum was a finance clerk. My dad sold his car to be able to allow me to go to do medicine. I lived in a house with no central heating because it was too expensive. And you can do medicine if you are from a working class background. It's just the barriers are so much more. You know, there are loads of sponsorship. I got lots of sponsorship from lots of charities and companies to be able to do medicine. And so I think we just need to advertise those better and make them better. I think girls are fine in medicine. There are plenty of girls who are surgeons who are amazing. Stella Smith, who's in my she's amazing, and literally I've never met a more driven, focused, accurate lady. She's fantastic, and if she tells me something to do, I go, okay, yeah, don't argue with Stella. She's ace. So I think medicine's getting a lot better, and it's getting role models to say, hey, look, you know, there are fantastic female leaders, there are fantastic female academics, there are fantastic LGBTQ plus leaders now in both academia, in societies, and I think if you see it, you can believe that you can be it. And I think that's what's changed, certainly since I was a registrar or trainee.
Here you are.